and Senior Design Director. And Mr. Ward, Dr. Ashish Mohan is the Head of Design, Technology, IP, R&D Department of CII. And Professor Manisha, you've already met, right, Dr. Ashish? So, yeah.
Yes, certainly have. Nice to meet you.
Same here.
Pleasure.
Great. So, Pooja, shall we start? Do we have
2 minutes.
participants and all?
Yeah.
So
Yes, we have participants coming in. We just start in 2 minutes. We are at 4:58. We'd start exactly at 5, please.
Meanwhile, how is everything? And I hope
better. Thank you. And there, how is it?
all well. Things back. The focus is back on the growth and other things. The economy is reviving. Technology focus is huge. So there's some good times. We are just the second wave is now almost declining, so we are kind of good to be back in the offices.
Am I having Wi-Fi issues or are you?
Sorry?
You were cutting out a little bit. Is that me or was that you?
No, it must be
that's exactly
me. It must be me. It must be me.
Okay.
People for the last 2 days have been complaining this to me. It is my side. Sorry, guys. But there's hardly anything that I can do.
No, I know. I have the problem at
cautious.
home, and I come into work and also have the problem. So everyone is experiencing that thing.
Yeah, tough.
I appreciate it.
With the permission of Dr. Ashish, Mr. Kurt, and Professor Manisha, should we start the session?
Please.
All right.
So whatever Mr. Kurt says.
All right. So a very good evening to one and all. Mr. Kurt Ward, Design Business Partner and Senior Design Director, Philips Design. Professor Manisha Phadke, Director, NMIMS, School of Design. Dr. Ashish Mohan, Head Technology, Design, R&D, Innovation and IP, and fellow leaders from CII. I welcome you all to the second session of Design Talk Series, organized by Confederation of Indian Industry in collaboration with World Design Organization and SVKM's Narsee Monjee Institute of Management Studies School of Design. The series is conceptualized to sensitize the Indian stakeholders the benefits of investing in design. This initiative will not only give boost to the existing design sector, but will also expand the thinking process on how to be more innovative and creative. Global stalwarts from different parts of the world will be invited to share their journey and experience with Indian audience to learn and gain insights from. I am Nitish Das, representing CII Design Team, will be happy to share that CII has been earnestly pursuing the strategy for promoting and leveraging design towards accelerating economic growth. CII has diligently worked to bolster and support the economy and society by demonstrating the vital role of design in making businesses more competitive and public services more effective. We are pleased to have World Design Organization's partnership for this initiative. WDO is an organization with global footprint advocating, promoting, and sharing knowledge of industrial design-driven innovation that has the power to create a better world. Our supporting partner, NMIMS School of Design, is one of the multidisciplinary schools at the Narsee Monjee Institute of Management Studies. The nucleus of the school is to impart future scope design education to prime the student to be a design professional in emerging scenarios. With this, now I would like to introduce Dr. Ashish Mohan, Head Technology, Design, R&D, and Innovation IP. Dr. Mohan is a doctorate in robotics and mechatronics from the Indian Institute of Technology, Delhi, having a rich industry experience of around 24 years, which includes working with companies like JCB India, Tata Motors, and High-Tech Robotic Systems Limited. May I now request Dr. Mohan to give his welcome address, please. Dr. Mohan, over to you.
Thank you. So Paul, it's to have
Dr. Mohan, there is some network issue. May I request if you're not able to hear you properly? Dr. Mohan, you are on mute.
A great example of our reliance of technology today.
Some issues.
Exactly.
Yeah,
So
designed by engineers, not by designers.
yeah, am I audible?
You're still cutting off.
Sorry, video पे.
Dr. Mohan, would you advise us to move forward with the session? Maybe we can just, move forward with the session and then come back to you for the closing remarks. Yeah,
Please go ahead.
Nitish,
Please go
please
ahead.
go ahead. Yeah.
So now I would like to introduce the chief guest for today's session, Mr. Kurt Ward. Mr. Ward is the design business partner and senior design director of Philips Design. In his current role, he is responsible to use design thinking to support strategic alliances and collaborations. He is based at Philips in the Netherlands and has led global design team for over 20 years. He was previously the director of research at Westwood One Networks in New York. Professor Manisha Phadke, an alumnus of IDC, has a professional career spanning 30 years, demonstrating a constant endeavor to imbibe and reskill to future-driven design frontiers. In 2017, she founded a transdisciplinary School of Design at NMIMS. Now I would like to invite Professor Manisha Phadke to initiate the conversation with Mr. Kurt Ward. Over to you, Professor Phadke.
Thank you so much, Nitish and Dr. Mohan. Welcome again, Kurt, and hope to have a wonderful time with you. But before we begin, I think I really appreciate CII's initiative to start the Design Perspective series, along with a big thank you to WDO for making this all happen. Coming back or diving in straight into the conversation that we are going to have, I think personally I'm excited because we are looking at design as is today, what is relevant and what should be the future in conversation with Mr. Kurt Ward. So Kurt, if I can bring you in and also welcome all the participants who have joined in and hope that everybody is safe. We are fighting the second cycle of COVID, probably nearing the third, but given our stance and strength, we will probably ride over it. Today is an excellent example of technology glitching, which is also something the pandemic has taught us to be able to be agile and meander into and make best of what we have in front of you. So here we are, and here you all are. Great. So, Kurt, I guess from a little homework that I've done about you, you spend a good time of your young life playing Congo and cracking the nuts excitedly to enthralling in a synapse of creative energy to getting into the problem and solving it, and now design that is utilitarian. At this stage of your professional practice, I think it's nice to understand what's your definition of design? How has design professional evolved in the last 2 or 3 decades that you have been in it? And maybe you can interpose it with some personal illustrations that help us understand that context better. Over to you.
Sure, thank you. It's a pleasure to be here. If I interrupt, it's because of the glitch again with the Wi-Fi coming from the other side of the world. But I didn't study design, actually. I studied business and marketing. Everything I learned from design actually was embedded here in Philips for the past 21 years. But the thing that the heart of it is actually, I think design is really about play, constructive play. And I say that because when you're playing, you are looking at connections and you're making hypothesis and you're, making abstract concepts around it. That's really the element of play, and that's where the left brain comes in. And the reason why it's so critical and such a minimal way to explain it is because we have this democratization of design. Design thinking and co-creation are embedded across many organizations. Lean and agile are, I'll say, intruding in the territory or joining the territory, depending on your opinion. We could have that discussion. So, everyone is really, leveraging design now, and it's growing from boards to meetings. But what the critical element of what I talk about here is that left brain side, which is a crafting, it's a capability to be able to understand, synthesize, reframe, conceptualize, and reframe. And that's unique to design. A lot of times we see organizations saying, well, everybody's a designer and they've embraced design, but really they've embedded a design process. And design is not a process. We have processes in design, but design is not a process. Without that intuition and that ability to construct, you can have any process you like, but you wouldn't get there. I went off on a little tangent. What was the second part of your question? Sorry. You're on mute, I think, Manisha. Yeah.
Sorry. So that's a glitch again.
Yeah.
We like the definition of design which you have put forth, but what my second question was that you have seen the profession probably evolving in the last 20 years, even in the duration of your Philips tenure. So
yeah.
What about
Right.
that?
No, that's a great question. So, talking about 20 years back, we really focused on individual products and user interfaces. So, we were a large consumer electronics company and healthcare company and lighting, and it was about the product, the individual product. But as we, started to understand people and context, you start thinking, well, it's not just the product, it's the context of use. Now, I'll give you an example in healthcare. If you know magnetic resonance imaging, an MRI machine, we have incredibly talented designers working on that machine. But we realized that machine is part of an ecosystem. So then we talked about, well, what's happening around the machine? So what are the people doing in it? Then you think about the room that the machine is in. Then you think about the workflow that the machine is in. Then you think about the hospital, the department, the ecosystem. So in essence, we're still embracing craftsmanship in product design, but we need to continually think about the bigger picture, because that product or that experience is only one part of a journey or an experience. In some cases, and in the future, you may not even see it. You may not realize that it's there. You're experiencing it, but it's not there. So from my point of view, it's not only keeping quality in product design, but also thinking about this contextualization of the holistic experience.
Yeah, I guess that sums it all up, that we're looking at now moving to a larger perspective of where design resides. I mean, it could be an ecosystem, service, policy, and what have you. With that, let's zoom out a bit and look at, since we are now here with two countries, and you're in Netherlands, we're in India. Let's look at the countries as a whole and how design manifests there. So all over the world, and even in the developing countries, so to say, design is being appreciated as a catalyst for a perceived transformation, right? I'd like to know, and also the people who have joined in, is how do you look at it as to bring in sustainable futures? So what's your opinion? Can we build sustainable futures like this, and how would you do that?
I love that you say sustainable futures. We usually say preferable futures, but sustainable futures is a much better context. It's in the industry that I'm in within healthcare, and also when we were doing lighting, we really look at when we really talk about a customer, we think about a population of people, not an individual person only. So
Sure.
for instance, for the city, you think about the tourists, you think about the retailers, you think about the people who are cleaning, you think about the whole context. Same thing with healthcare. You don't only think about the patient, but the doctor, the ecosystem, the family of the patient. And when we think about a society, there are two huge elements that are critical here. The first is, of course, the idea of sustainability and the lagging resources that we have. We're at a perilous moment. There's never been a greater time where we need to stand up. And I say we stand up, and I've written blogs on this. I really think it's design's role to stand up. And I think actually, without being arrogant about it, we are the only ones. And then maybe to give you a context, I did a workshop with the entire city government in the north of Europe. So that was the person who's responsible for energy and infrastructure, the person responsible for health and services, the person responsible for education, and so forth, waste management. And it was literally the first time that they had ever gotten together to think about how do they work together as functions in the city. They always thought, well, I'm responsible for energy management. I got it. You do your thing. But suddenly there was this realization that, well, what if, what's the implication on waste management on the health outcomes of the city? What's the implication of energy management in the retail environment for the business sector, right? These cross sections. And you can take it, all the way further when you think about entire energy ecosystems, or you think about urban living, or you're thinking about even agriculture in remote areas. We need, in order to create this transformation that we need to do, we have to transform ecosystems. We can no longer only rely on individual product interventions. They still need to happen. I'm not denying that. We still need to make fantastic new exquisite products or services. But unless we think about the entire ecosystem as a whole, we're not going to make the change that we need to do. And when I say the change, as you know, we need to make a radical change. Business models, financing, inequality, health, not to mention the environment and energy, and just the thought of, how do we live as people? And the COVID crisis has really, I think, struck through. What does it mean to be a society? What's our responsibility towards one each other? And what's our impact on the world?
True, true. I think that's a wonderful conclusion to how we can perceive sustainable futures. I think everything being connected is the way of life. I mean, if you look at body as an example, and in part of my project, I was delving into that. There is not a point not a system, not a material, not a process in the body that is not connected and impacts somewhere else. Right. And I think, if you're a doctor and looking at it as a doctor of medicine, I can't imagine the connections. It's almost like the synapse of the neural network firing away, right? And if we as designers can, bring that connection and find which is the right connection for us to solve, what's the problem there? I think, what you say is true. We will be able to have feasible and probably sustainable futures. So with that,
can I also add that, we as designers, we have to step up to this. We're not going to be asked for this. We have to make the change, and really it's our behaviors and how we propose things that's really going to make the difference. And when I say that, I mean moving away from being design as a service provider to design as actually a strategic influencer, and it's our role in order to trigger it.
Right. It's almost that you drive the action rather than receive the brief, which was probably 20 years ago scenario.
Right.
Yeah,
right.
That's good. So let's also look at global aspect in a different way. So it's great that the world is yes, it's a globe, but we are different countries, we're different cultures. We are looking, our perspectives are different, our economic levels are different. So with that said, I think all this really dovetails into the person you are or the designer you are. So that's where I'm coming to right now. So you lead a lot of global teams, work with a lot of global teams. Maybe you have a diverse design team as well, which works on product strategies, ecosystems, but again, for global consumption. So there are
Yeah.
two aspects of it. One, the team is global, comes from different culture. One is that the consumption or what you do is for the global audience or the user. So I would
Yeah.
like to dive in your experiences in this journey, and find out that there are some countries where design is still a luxury. There are others where it is a necessity. There are a few where design is intrinsic to the culture. So what are the considerations that you account for when designing for global consumption? And how do you make these countries design ready, so to say? How do you mix? Again, it's a connection of three different points: the team, the product, and the space or the environment that you're going to put in the ecosystem.
So there's the two elements. I mean, let's say 30 years ago, Philips is a huge company, and in fact, in the 50s, 60s, and 70s, everybody thought Philips was a local company, right? So in Mexico, they thought Philips was a Mexican company, and Canada thought Mexico was a Canada company.
Interesting.
And we literally did create products in those regions or those countries. So we had design teams and engineers, and they would create these local products. And then, of course, in the 80s, you started thinking about brand experience and about the brand and the integration and the overlap and consolidation. And we've moved to this a bit of more central integration view where, we have teams in India who are developing products around the world. We have teams in Bothell, in the United States that are developing it all around the world. But I'm seeing that also now, because I directly deal with all the markets in the world, is that there are two elements to it. There's one thing which says, yes, there are many things that we can replicate. There's the 80%, 80-20 rule. 80% is going to be, standard across the world. But that 20% is going to be critical. And that 20% is really around local, social, cultural means, without a doubt. And, we're still, in effect, suffering from this idea that, everyone around the world is a UK, adult or an American adult, right? And that is so not true. And, while we have globalization, there's also this pushback now. Societies are saying, yeah, but we have our own culture. We have our own way of seeing things, and you're not designing around me. Now, some countries may aspire to be others or, see that, like they'll like a, German football player. And so there's an aspiration, but that's not the same thing. So what I mean is that now we're going back into this idea of saying, well, it's 80% global, but that 20% is actually literally has to be local. That's the one side. And then when you talk about design's influence in every culture, that's a difficult nut to crack because there are many elements to it. So how we perform. So in China, for instance, there's a specific culture, and I have to say, China is really now much more embracing design than ever before and letting designers doing it from a democratic point of view. In India, there has always been an inherent, sense of beauty in the world and the sense of connectivity in the world. And you see that reflected in a personalization there. But then again, the question is, are we being subservient or do we take a larger role? But the reverse is also true. Now we've got this whole lean and agile thing going on. So Europe and North America have said, yeah, we embrace design, no question, but now we're going to put it and make it structural. So it varies. I don't have a good answer for you on that. I wish I did.
Yeah, I think it is the 80-20, like you said, and probably the word is critical. And like if you visit India again, you'd say that the McDonald's India has redone its menu, right? And
Yes.
it needed to do that 20%, and Uber
Yes.
needed to do that 20%. So I'm
Yes.
sure what you're saying is the practice, and I think one size fits all will never be what designers do. Others will never solve a problem. So we have to retain probably that criticality of 20% and the local. And as you mentioned, that it could be today because of the technology. You could be sitting in Mexico and designing for India. That's possible by doing the kind of research, but the 20% still remains. I mean,
you still need that. So in fact, when I joined 20 years ago at Philips Design, Stefano Marzano, who is head of design, specifically hired anthropologists, psychologists, and sociologists in order to ensure that we as an organization were being social cultural relevant and understanding. And that's had a huge impact on us, because you can imagine, you see a lot of brands where, they're very much of their location. And
Right.
you could say the same about Philips. I hope not, but there's much more effort to be put into it.
Yeah, with that, I still want to tag you on the second point that I mentioned. So this varied perception, sensibilities to design, does it alter skill sets? So you're hiring designers in China, in India, in Mexico, in America, and wherever Philips is, in Netherlands. And so does this varied perception and visibility alter design's skill sets or attitudes or perception or maybe creativity in the team? And how do you handle that? Do you iron out something? Do you enhance something? How do you manage this diversity of skill sets because of culture?
Yeah. We've been so if you think about it historically, creating multidisciplinary teams happened with Louis Kauf back around 60 years ago. So there's actually there's a historical trend in our DNA of Philips, because Philips as a company has been very people-centric because of our founders, which I'd love to go off on a tangent and talk to you about, because I adore that. But that being said, we have embraced this idea of really having multidisciplinary teams, and it started with not only in the design organization but across the company. So multidisciplinary in terms of engineers and scientists and anthropologists and trends, but also UX designers. So that's how you create that. But I would say, which was the first question? I forgot. I got so excited about talking about Philips.
No, so what I asked you is, it's nice to have multidisciplinary teams, and that's the need of the day. But in that
Oh yeah, skills.
multidisciplinary, you would have different, you'll have an Indian, a Chinese, a Netherlands, a European, an American, and how do you deal with all that? It's
Yeah,
also
yeah.
a cultural mix.
Yeah. So again, multidisciplinary teams, and we are the design organization is the most multicultural in all of Philips. So not only from every genre, but I wanted to get back to the question around skills.
Yeah.
You will always need, if you think about an orchestra, you will always need a first violinist, and that first violinist, their job is to be the perfect violinist, the craftsman of it. That's what they need to focus on. We're always going to need them. But more and more, we have these little orchestras. And so you need to have musicians who are able to stand up and lead the whole group, whether they're violinists or cellists. So this T-shaped designer. And that T-shaped designer is really, the crux to be able to start thinking about where's the overall strategy, this holistic point, the end-to-end, how we're going to manage ecosystems. So you think about new skill sets and how they're developing. That T-shaped designer is really coming to the forefront today with service. That T-shaped designer not only needs to understand design skills, but needs to have a little bit of business context, economics, society trends. They need to really have a holistic view. It goes back to Leonardo da Vinci. Leonardo da Vinci is really the perfect example of that. I don't know how we lost the Da Vinci concept along the line of getting these specialists, but we not only need specialists, but we need Leonardos.
Yeah, this brings me to a funny incident about 15 years ago when I said T-shaped individuals. People really quick questioning me, and how can you be T-shaped, right? But today is the need of the hour. Even our school has a curriculum that sits on the cusp of technology, design, sciences, and business. So it so resonates, though it took a decade to come to the forefront. But now that it has come, I'm sure we'll have solutionists as well as specialists to make a design team, and then a multidisciplinary team where the designer infuses his or her ways of working on. Well, I want to get to another passion of yours. In one of your talks, you relate your passion to bring in societal change. I mean, you were talking about environment and your space in it. You also admitted that, yes, the societal change is slow, right? But to take your words, man, his consciousness, environment, consumption, sustainable empowerment on earth. Can you expand on what these mean to you now?
Yeah. We, I guess the context is that, and it goes back to Leonardo da Vinci also, we as society, or as the humankind, have become very human centric, and we've shaped the world around us. I mean, from everything from cities to energy to light, and that has created great benefits. We are seeing a reduction in poverty. We are seeing an extension in lifespans. We are seeing, less, let's say, oppressive governments and other things. We're not all worried about being attacked by wolves in the forest, as it were.
Right.
But the result of that, from the Enlightenment till now, has really been this human-centric dominance, which now we see the impact on every other ecological system, on animals, on the air, on the water, on the planet, let's be honest. And so, it really needs time that we need to go back and see that the world is not human-centric.
Yeah.
The earth is not human-centric. We have made it human-centric. And, we have to create this equilibrium. And to create this equilibrium, we're going to have to balance the good and the benefits, the needs that we're creating, and the large population that we've built, the greatest population, largest in history, next to that ecosystem. And that's going to require very strategic thinking. That's going to require very holistic thinking. And that's going to require very advanced, creative, constructive play. And that's why I think design needs to take the leading role in being able to do that, to bring all these multidisciplinaries together, but then to help them thread that, to help them ideate that, and in your words, create sustainable futures.
Yeah, that's a very nice perspective you put in. So we all worked and we advocate human-centered design. But today you're saying that maybe that should change a little bit and look at it from different perspectives, and tied whether the human-centered needs are also equal to the environment or the visual noise or whatever we are putting it out there. I think that's really interesting perspective. So we are already going ahead on saying probably we need to coin another word, human plus something centric, so
That's
that
right.
we get a holistic view of what we had to do. So
If
what
you make that, please let me know what that is. I would love to start using that.
I will surely. So another thing which I wanted to question and learn from you is when you're making design decisions all the time, right? And you are coming from the premise of sustainability world and human-centric holistically, right? So what are the factors in design decisions that, sometimes you did make a decision which was controversial, but what in some places you made a decision for sustainability of products life cycle, or, give us some examples if you can, to, you are sitting at a seat of power, and there will be two ways of getting there, but some good ways and some not so good, happy ways.
Yeah. That's a very critical point. I mean, just from a pragmatic point of view, if you think about nuclear power, I'm going to use this as an example. At some point, somebody thought, the benefit that I'm going to create from nuclear power is going to outweigh the other issues. And I understand that, because we have an energy issue, and nuclear power creates an awful amount of energy in regards to putting into the system and taking it out. But I thought about this last year, and I thought, but did they ever think to themselves that what I'm doing, 200,000 years of people will still have to manage? In other words, I'm creating something now which I'm going to get the benefit, this generation will get the benefit on, but I don't know, what is that, 200 generations from now, they'll be dealing with that. So it puts in a context, what is the real cost? Yeah, because I'm sure when they went to the business plan and they said it's going to cost this much to build, this much to run, this much when they get it, did they add up 200,000 years of waste management, right? So, and from a Philips perspective, we're also thinking the same thing. And just last year, our CEO announced we are going to take back all of our equipment and put it into the circular system. And
Which is
now,
wonderful.
yeah, and that was a broad statement, and he said it publicly. Now, I have to say, the reason why it's so bold is because he didn't tell the organization. Our organization is not prepared to do it yet, right? And we haven't looked at the whole context around it. But he said, if we are going to be true to our values, which is we want to improve the lives of 2.5 billion through innovation and sustainability, then how can we do this? So in a way, there's this boldness of saying, this is the right thing, we need to figure it out afterwards. And there's something about, as designers, we want to figure everything out at the beginning, or, we want to figure everything out wholly. Sometimes it's really good just to say, you know what, there's a point on the horizon and we'll figure out as we're going to go, but that's the right way to go. So taking that judgment call.
Yes, I think so. And we should appreciate the CEOs to even say this bold statement. When you say it, you'll probably find means to make it happen. Yeah. So
Yeah.
when we refer to design with a purpose, okay, environment, sustainability, healthcare are top of the hat areas. And healthcare is something that you work in. So can you relate through your experience in working in the healthcare industry? What are the key aspects of design processes? So we had design thinking, and it's right that it is inclusive, but because it's healthcare, okay, and it's not lighting, are there processes that you may change, some amendments, some deliveries? How does this whole team work around in healthcare under you, or that is led by you?
So there's the one fundamental point. Healthcare is a service.
Okay.
And I know maybe most people tend to think about healthcare as its medication and its equipment and its surgeries. And yes, it's all those things. But at the bottom line, healthcare is a service. And it is a service between people. You will always, no matter how advanced we get with AI and robotics, I do not believe that we're ever going to discount that you need doctors. There will always be doctors and clinicians and specialists and nurses. There will always be. There'll always be patients. So it's really a people-centric thing. Now, what we've gone through as an industry is we have gone through an industrialization of healthcare, and we've seen healthcare as a, let's say, industrial delivery. So when we construct technology, or when we construct clinical services, or when we construct hospitals, we think about it from the point of view of, it's an engineering clinical process, but we forget the people. Often we forget the people. Too often we forget the people. You'll see that with having multidisciplinary doctor teams that aren't really communicating to each other. I'm sure you've all experiencing that, right? That is probably the biggest. Anyway, that's one of our biggest things we have to solve. That's one example. But let me give you a very pragmatic example, what that means to be, it's about people in healthcare. If I use the MRI example, magnetic resonance imaging, it's that really big machine with a round circle that, a person has to go into, and it creates a very loud noise because the magnet is going around, and it's a very scary process, frankly. Now imagine you're a child. You're a child that, basically needs to be diagnosed, and you need to go through this diagnostic. Now, first of all, hospital is a very scary place for children to begin with. I mean, just think about it. It's usually white. It's usually filled with doctors in white. It's usually hectic. It's not exactly a child-friendly place to be. It's scary for adults, let alone children. They don't know what's going on. It's scary. Now you're going to take them through a process where, they have to participate in this diagnostic, because when you're in an MRI machine, you have to do certain things. You have to breathe at certain moments. You have to be still at certain moments. You have to participate in that process. Now, when we, about 15 years ago, the design team was doing research, people research, to say, how could we improve the throughput of diagnostic imaging. In other words, how can we get more people through an MRI in order to deliver more value and to create more diagnostics and help, right? It's an expensive machine, so you have a limited number. So the more you can get people through, that means the more people you can help. It's just a logic. And what they started to realize, we said, well, but how much can I tweak the machine and the interface? And there's a certain extent that you can do that. But they realized that actually the biggest problem was not the machine, it was people. It was the workflow. So it was the doctor, the radiologist, the child, the family. It was the process around that the MRI process that really was limiting the ability to do throughput. So then we started to do a deeper understanding around that. And so we started doing interviews with real people, and like you talk to a family and the mother's like, well, I'm scared for my child. One, they might have a disease that, is going to be horrible. And two, I'm scared for them going through this process. And three, I don't understand this process. And four, I'm not being communicated to. So it's frustrating. So there's this nervous energy around the family naturally because, they care about their child. You talk to the child and it's like, I don't know what I'm going through. I'm scared of what I'm going through. And fear and scare, being scared, create this environment that, of course, you're not going to be conducive to following instructions and doing the process well. So then we realized that we created a hypothesis and we created a kitten scanner. Now, a normal MRI is as big as this room. We created a kitten scanner that's down here. It was basically 4 feet high. In actual reproduction, it looked exactly like the large MRI. But what we did was we created these foam toys. So we created an elephant, a kitten, and a cat. And then we created this video and we said to the child, look, as you're waiting for this procedure, would you like to know what you're going to go through? And would you like to see what Ollie the elephant is going to experience? So then they take Ollie the elephant out, which is a stuffed foam, doll. They put Ollie into the machine. They move it so he's inside the machine, and it starts a video. And the video explains, this is Ollie. This is what Ollie's going to go through. This is what Ollie does at this point. This is why Ollie, you explain it in very simple, easy terms. And that had a tremendous impact. Because then the child understood when they were in the machine and the doctor was saying, okay, now I need you to be still. They thought, okay, Ollie was still here because of this. And Ollie did this. And also Ollie came out safe and okay. And it increased the throughput by a tremendous amount of time. But maybe more importantly, it created a people-centric approach to healthcare. It was people-centric. They had better diagnostics because they had a better image. The patient had a better experience. The doctor was able to do more. And by the way, the doctor didn't have to spend his time worrying about the child or managing the child. He could do what he did best, which is to treat. That's an example for you of healthcare design.
Mm-hmm. That's interesting. It's also pointing to, if I can say, and you can comment, is Philips has in particular, like you said, a focus on participatory design. So to make the difference, the change in the tagline that they did, from sense and simplicity was the tagline before, to now it's innovation and you. So
that's right.
is that how you want to transcend this journey? So innovation and you is all about participation, one in which design process. So can you elaborate that change? It's admirable that Philips made that change in the tagline, and it made it in the tagline, which means it made it in its own processes. So
our current design officer, I'm going to have to use something that he talks about. He says the reason why designers usually wear black turtlenecks is not because of that famous Steve Jobs. It's because when they're going in the hospital, they're going to get blood on themselves. And so, in essence, what we're saying and Philips Design is that we need to be in there where it's happening. We need to experience what it's like as a patient, what it's like as a doctor. And that's real context. And we need to work with the nurses, the technicians, the radiologists, the doctors, the insurance companies, the ministries of health. We need to understand them in order to go for a design. And it's the reverse of the technology driven, right? So yes, we have this technology. What do we do with this technology? Now we're going to create this. And that of course still has an implication. It still drives us. But without that context, we're not really doing our job right. And that's a never-ending journey. I mean, we are in many ways not only doing it in terms of usability, which of course everybody does, user testing, but earlier in the process, when we're in these 5 to 10 year out concepts, we're already starting to work together with clinicians and patients to figure out where we're going. We had this future of neonatal intensive care unit concept completely out of the blue. Like, this was what we think a NICU could be in 10 years. And we literally said, look, we may not design any of this. We may not produce any of this. This is a provocation because we'd like to understand, where do you think we should be going? And that helped us really start to understand how we're starting to drive real innovation forward, as opposed to always catching up with, I have this technology, how can I use it? I have technology, it's like catching the ball, honestly. I've got 5G now, what do I do with it? And I think that we need to rethink that process as an industry.
That's interesting, because if you're looking at design as a transformatory experience, then probably we need to get all these aspects together and be solving the problem from inside out rather than outside in. And where technology is probably weaved into it, but science drives it, and design probably becomes just a facilitator or a provocator. I think that's really interesting. I know you have, I don't know whether this is the one, but I personally would be excited to work in your cube of ideas, right? Wherein surfaces of the room are a canvas to write notes, to doodle, to draw.
Yes.
In other words, it's an environment to aid a culture
Yes.
for creativity to thrive, right? I mean,
Yes.
I'm sure you're there. If you look at your organization, which is 100 plus strong in a global footprint, and you mentioned that you would want to have a separate conversation of how you drive design as a culture, but I'm giving you the chance to opine right now. So as an organization, it would be interesting to hear how Philips has inculcated design culture first, where it made beautiful, meaningful products, and now where you sense, and again, there was experience design in it, and now it's innovation, which is participatory, which is even a step forward in building that design culture. So how did you bring it? And now in that mix, you've also brought in sustainability. You're looking at, as an organization, that aspect as well. So hey, we'd love to hear your thoughts on that.
That's a lot to unpack, if you put it that way.
And then you have your global clients, right? I mean, you're
Yes.
actually working for them. So how does that work?
I mean, so it's interesting because if I've got a number of things, let me write down what I just say. So let me start with one thing, which is and I've done actually I did a lecture on this, which is the history of Philips design and how design has impacted the strategy and vice versa. I believe it's 9 years ago or 8 years ago, the management team, our CEO now, Frans van Houten, decided specifically to say that design is not just a function, but it's a core capability we need in the strategic direction of the business. Which means that we have a designer who is on the management team of all of our businesses. So if you think about connected care and you think about precision diagnostic, there is a designer sitting at the business strategy table, and they're not there to report on, how many designs did you do today? No, they're there to influence the strategy and the business. And that's had a pretty significant impact, because when we think about these sustainability discussions, that's a very scary, challenging discussion for a business, because it's going to require initial investment.
Right.
And there may or may not be a return on value monetarily afterwards, on brand, society, increase in market share, yes, but maybe not on that. So those dialogues are becoming much more, let's say, dynamic within the organization. And you mentioned the global customers because what's interesting at Philips is that we are not only designing our products, but we now have our design teams who are going into hospitals and helping the hospitals to design their system, independent of Philips products. And that's quite a new development, because you'd think of Philips, okay, you develop products, you install them, and you go away. But the reality is because we've been thinking about these holistic ecosystems as a design organization, we understand clinical workflows. We understand patient experience. We understand technology too. And that's a very rare combination, which when you leverage the power of the hospital staff and the patients in a specific hospital and you put together, we are able to create 1 + 1 = 5 rather than 1 + 1 = 2. And we're still, it's still a very new, let's say, development. I mean, we've done probably, I don't know, a couple of hundred of these things, and we're doing it everything from maybe a emergency room to literally the whole hospital in the Middle East, of the parking lot to the, you know, to the outpatient center. And now we're even doing it with countries. How can we help the country design their healthcare system? And I could say that, you know, it's not because we're trying to sell more Philips products. That may be a result of this. But because of the nature of our organization, we at Philips say, look, we need to help our customers, the hospitals, be successful. If they are successful, we will be successful with them. So it's a different thing, not saying I want to be successful on your behalf or from you. I want you to be successful, and therefore I will be successful. And that's a changing dynamic, which I think not only in our industry, but I think you need to think about it in all industries.
I think that's a great thought to take forward. We do have some companies in India that resonate this logic. But I think my dream is to have all of them. And with this CII, I'm sure there are many even SMEs listening to it. And it's okay to start small. And actually, if you work in tandem, you're not doing it for somebody, but you are facilitating that success, and that's why your success. That's a very, very interesting point. I mean, something that just drives home how integral design or design thinking is to anything that we do. So I'm going to come and I'm going to tie in what you said earlier. You know, you talked about a multidisciplinary team of sociologists, psychologists, designers doing a full range of what is designable. I want to say that everything is designable. So whatever you have, like you mentioned, I mean, I can't even put a media to it. So what is designable for enhancing lives? Yeah. So you have, what we really want to talk about is that the multidisciplinary team has come, and there are many things that you start designing with, because you are actually enhancing lives. So if a hospital system is the way to go, that's what you do. So what I wanted to question is, design is now at the cusp of technology and sciences, as you said, right? So what are the attributes of the skill set expectations of from a designer who gets hired, or even people who are listening to this talk today? There are many companies who would like to hire them, and then what is their skill set? What is their ideal toolbox that they bring when they get hired? Do you have some thoughts on that?
Yeah, that list could be endless. Empathy.
Let's start with a few.
Empathy, creativity, contextualization. But it starts with listening, really, really listening and probing and triggering. As a profession, design has been a bit egocentric. And I'm not discounting that. I mean, we have, Le Corbusier and Frank Lloyd Wright, and we have Frank Gehry. We have these monsters, Leonardo da Vinci, monsters of design who you look at it and okay, that's them, and that's their personality. And you have organizations like that too. Apple being one of those. It's a personality that is still embedded in it. But more importantly now, when we think about ecosystems, when we think of multidisciplinary teams, and we think about understanding context and business models, in my mind, that needs to move away and we need to become humble. I think humility and humbleness with that feeling of authority to constantly be able to trigger is really the critical element for designers. Aside from the skill set, I can't draw a line, by the way, for the life of me. I cannot draw. I can't draw a solid line, but I can take 150 people through a process to transform a hospital organization. So I think we need to think about it from the point of view. It's what is our relationship to the entirety of the whole, as opposed to our individual contribution and our individual stamp on something.
Yeah, I think there are different kinds of designers. Is that what you're kind of saying, that there could be thinking designers, the empathy driven, but there are these 3 or 4 tools, empathy, being a listener and being humble, maybe the top of the chart skill sets. Is that
Well,
and empower?
triggering. So
Oh, okay.
listening and triggering and synthesizing, to my mind, are the core things. And
Great.
it's not so much that every designer has those at a high quality, right? When you become a designer, you're not born with those things. These are skills that need to be honed. As people, as
Right.
humans, they need to be honed. And us particular, we have to hone them even more. We have to be even more empathetic than a psychologist.
Yeah, true that. Yes, yes,
As an
yes.
example.
Yeah, I think it's interesting. So I think we've got a lot of questions. So amongst our viewers is a large percentage of decision makers, who can wield this transformation that you're talking about. They have the power, the seat of power to do that. So given this pandemic, economic downslide, what's in your view? How is design critical there? What can we do? And how can we get all these things up back again, or have a different life to lead? Which can help these decision makers.
I'm going to sound like a broken record here because we have all experienced that the ecosystem we live in is not correct, is
Okay.
appropriate, not adaptable for these situations. It was not designed for this situation. Now, the interesting thing is that we know that healthcare systems around the world were already stretched. We're already at the maximum capacity. Financing, outcomes, patient outcomes, costs, staff retention, staff availability. It was already there. Then you have COVID, and suddenly it's like, okay, now it's really on everyone's radar. And the good news about that is now societies are starting to, that trigger happened. We have cities and countries and governments and literally regions that are now saying, okay, we really need to look at this from a holistic point of view and think about it that way. So in a way, there was a benefit to this pandemic because it was so brutal. And then it goes back to us as designers thinking about, okay, let me help you understand the end-to-end value chain. It wasn't enough that we could ramp up productions of ventilators, which we did at a remarkable speed. It's how do you get that ventilator to the right people? How are they going to use it? Are they using it the right way? Do they have a location to put it in? It's the same thing with vaccines or with tests. Great that we have this test, but can we get it to people? Is it being used? Is the data being used? Right? So this interconnection, just really we had to learn as we grow, or as it happened. So not only individual interventions here, but thinking about, okay, what do I think about it beforehand and after? The value chain. And by the way, how do I get it to the market? How am I going to manage it in the market? And what's going to happen with all those masks and vaccines when they're done? Where are those going to go? Right?
Oh yeah, yeah, yeah.
So
the whole
we have a
cycle.
big job to do.
Yeah, we do have a great job to do. But just to conclude what we've been talking about, it's been an hour. We didn't realize we're doing that, but we've gone from how design or a designer's role in a team, in a company, in a transformational exercise, to being responsible for a product, but a product in the value chain, or maybe in an ecosystem that connects with another ecosystem and actually lays the foundation of a sustainable world. I mean, if I can put it in the short
And I would add, not only today, but also tomorrow.
Also tomorrow, because that's the point about your vaccines and what do we do with the syringes that we have used. Yeah, that, I don't know how it's going to go into the circular economy again, but that's a problem that we will also have to solve very soon. With that, Pooja, do I have time for questions? Can I take some of them?
Yeah, you can take probably 1 or 2 questions, please.
Sure, thank you. So, so there's a question from Mr. Rupesh Vyas. I hope you're listening. How do you consider the environmental impact of product design you are generating for different countries? Do you discuss these points while designing products for a specific country? How exactly do you use data about environmental impact of products that you're generating? So it's really after the product gets done. So Kurt, do you want me to repeat the question? It was a slightly long one.
No, it's a great question. Not so much in our design specific role, but in our design role and in understanding the ecosystem. You know, what we are need to get more advanced on is, so for instance, does it make sense for me to put a factory in Belgium to make an MRI machine, ship all the, you know, elements, the ingredients to Belgium to have it produced together, to then send it back to China or to North America or to Canada? Does that make sense? So what we're starting to see is a logistics, let's say, growth around data of resource extraction, manufacturing, and distribution. And what is the overall cost? Because, you know, sometimes it actually might make sense to, maybe we need to put little factories everywhere to do these things rather than having one, even though the old mindset is you have one factory because you can optimize, you know, the Henry Ford model. But if you add in all of these ecosystem elements, the transportation, the shipping, the cost, the logistics, the taxes, the so forth. So it's a great question. We're not there yet, but I would love it if you could solve that with us, whoever asked that question. That would be great.
Okay, with that, I think we have one more question we can take quickly. So it's from Mr. Jnaneshwaran, if I can say the name correctly. He said, during design research, by empathizing customer, we collected data of extreme and non-extreme users. But finally, we grouped the ideas by converging, synthesizing, and what he really means is just the group decided what to do ahead. So the people who researched, who synthesized the idea, and that's the group decided. So should we require an anthropologist and psychologist for fine-tuning thoughts once again to take a final decision? So should the design group be empowered to take the decision, or should we get some more other people to do that, is his question.
You know, it depends on your budget, your timing. The more validation you can get from multidisciplinaries, including users, anthropologists, sociologists, the better you're going to be. That's going back to this thing about empathy. We should constantly we should feel confident in our triggering and our concepts, but we should be every moment humble to say that we got it wrong or that we don't have it right. I can't overstretch that enough. And that trigger to be able to say, yeah, but I created this and I heard you, look, it's great. You know, yes, but it should not impact your ability to be able to say, but it is not totally there.
Maybe it could also, you could also work with a little bit of users into the process. So you have another perspective.
Throughout the process. In the process. Throughout.
In the process.
if you can, that's the perfect thing to do.
I think, Jyoti, your question was how human resource in healthcare organization, mainly hospitals, can promote design thinking culture. I think he's answered that in the conversation, but if you want to add up, Kurt, you can go ahead. How human resource in healthcare organization, mainly hospitals, can promote design thinking culture.
Yeah, I get that question a lot. And what we've done is we've, so the first thing is that you need to create this environment of continual improvement on its own. So the management team needs to say, I do want to have continual improvement and I want to empower that. So you need that first. Then the second thing is you embed design thinking with the entire organization. When we develop a new hospital, literally they're going to build a new hospital. We go in with the nurses, the clinicians, the radiologists, technologists, and literally behind me is an example of this. We do that with them. So we're not doing it to them or for them. We're doing it with them. Now, yes, there's a lot of design thinking that we put into this that we add, but the entire process is together with the patients and the staff. And when you do that, you get two incredibly great benefits. One is you get this idea of behavior change because they have developed it with you, so therefore they're more likely to go that way in that workflow and that new design. But number two is you got that thing of, I actually am an expert. The nurse is the expert, not the architect. The nurse is the expert. And that reinforces this idea that you are in this process. And we've gone even further to help hospitals literally create design and innovation centers within their organization, providing them tools. And they've even, many organizations have design now. I mean, Mayo Clinic has an incredibly large design group. It's an astounding large. Great facility too.
I hope that answers your question, Jyoti. With that, thank you for being a lovely audience and a lot of questions. And I love the excitement that you brought to the table, Kurt. I mean, there's so many things that we talked about. There is another question from Dr. B.L. Salvi, but we take that as a separate webinar. He asks about elaborating creative destruction in design. So that's probably another question, and we'll take it in another full webinar for an hour. Very great question. Thank you so much, Pooja and Nitish, as well as Dr. Mohan. And first of all, you, Kurt, for stealing some time and having this wonderful share. Thank you, CII and WDO as well. Have a great evening. Over to you, Kurt.
Thank you so much. Thank you so much, Mr. Kurt Ward and Professor Manisha Phadke for such an interactive and insightful session. Mr. Ward, your inputs on every design being 80% global and 20% global, the need for design setup being multicultural, requirement of T-shaped design person to give a holistic perspective, sitting at strategic table of a company, and the skill sets are vital for audience present here. It was indeed an inspiring session for all of us. Thank you once again.
Thank you.
I would like to thank everyone for being a part of this Design Talk series. We look forward to your presence in our next session in mid-July. Till then, stay healthy and stay safe. Thank you so much.
Thank you so much.
Thank you, Professor Manisha. Thank you, Mr. Ward.
Cheers.
Thank you.